Good morning, everyone, or good afternoon, or good evening, whatever you are. I'm pleased to welcome you to the launch of the 2023 annual report of the International Narcotics Control Board. INCB's annual report presents an overview of the global drug control situation and makes recommendations to governments and international and regional organizations on how to better implement the provisions of the treaties. The INCB Precursors report summarizes the action taken by governments and INCB to prevent the diversion of chemicals to illicit drug production and to implement the provisions of the 1988 Convention against illicit traffic in narcotic drugs and psychotropic substances. In the Internet era, the international community faces both challenges and opportunities for drug control, prevention, and treatment. This is explored in the thematic chapter, called also Chapter 1, of the annual report on the role of the Internet, including social media, in drug trafficking and use. The main observations include criminal groups are exploiting legitimate e-commerce and other online platforms for the trafficking of narcotic drugs, psychotropic substances, precursor chemicals, and new psychoactive substances. The online presence of vendors for fentanyl and other synthetic opioids raises serious concerns in view of their high potency and the risk of overdose deaths. Law enforcement authorities face difficulties in monitoring and prosecuting these activities due to encryption and jurisdictional issues. Social media is increasingly used as a local marketplace for illicit drugs with implications for young people, including children. INCB has been supporting governments in preventing exploitation of the Internet since 2009, when the board released its guidelines for governments on preventing the illegal sale of internationally controlled substances through the Internet. More recently, INCB has developed practical tools to facilitate international trade and controlled substances. INCB's Precursors Incident Communication System, known as PICS, Ionic System for exchanging information on incidents involving new psychoactive substances, and GRIDS intelligence are supporting governments in addressing trafficking in drugs and precursors. On a more positive note, social media and the Internet also present opportunities. The rapidly growing area of telemedicine can be a valuable resource for reaching patients and improving access to treatment services for people with drug use disorders. Social media platforms also have the potential to reach young people with drug prevention advice and help raise awareness about the harms of drug use. To address the threats and maximize opportunities, INCB recommends that governments conduct drug use prevention campaigns utilizing social media. Governments identify private sector companies, industry associations, and related stakeholders vulnerable to exploitation by traffickers of synthetic drugs, and work with the INCB GRIDS program to facilitate such public-private cooperation, including by utilizing the INCB practical guidance for voluntary cooperation for e-commerce and internet-related services. Governments also should use the INCB Opioids Project's fentanyl-related substances list and the project's other lists of dangerous substances with no known legitimate uses to encourage industry partners to refrain from manufacture, marketing, import, export, or distribution of the substances on the lists. Governments also utilize INCB tools to support ongoing real-time information exchange between national authorities. State parties are encouraged to utilize the real-time counter-trafficking tools available through INCB systems to develop actionable intelligence that help authorities identify and link traffickers that exploit Internet-related and e-commerce services. Data reported to INCB continues to confirm the persistent regional disparities in the consumption of the main opioid analgesics for pain treatment. Almost all consumption of these opioid analgesics is concentrated in Western Europe, North America, Australia, and New Zealand. Consumption levels in other regions are often insufficient to meet the medical needs of the population. This is not a result of any shortages of raw materials. A global supply is more than sufficient to meet the demand reported by INCB by governments. The estimated requirements of a large number of countries may not accurately reflect the actual medical needs of their populations. For comparison purposes, INCB uses an indicator, regional SDDD-PM, based on the country's reported consumption of the overall amounts of opioid analgesics reported as consumed. Using this indicator, the graph shown compares the regional consumption of the main opioid analgesics in 2022. Levels of consumption of opioid analgesics in Africa, Central America, and the Caribbean, East and Southeast Asia, and South Asia are considered to be inadequate or very inadequate. There is an urgent need to increase the availability of and access to opioid analgesics and to improve their prescription and use, especially in countries reporting inadequate levels of consumption. INCB is calling for targeted public policies supported by governments, health systems, and health professionals, civil society, the pharmaceutical industry, and the international community. The limited data on consumption of internationally controlled psychotropic substances used in the treatment of mental health and neurological conditions hinders the ability to assess availability of medicine containing these substances. Where data is available, we see fluctuating levels of consumption among countries and for different substances. As in the previous years, 10 psychotropic substances accounted for 80% of all global manufacture of internationally controlled psychotropic substances by gross weight in 2022. Overall trade in internationally controlled psychotropic substances in 2022 remained at a level similar to previous years. The available information is insufficient to determine whether the quantities traded are sufficient to meet the actual medical needs in these countries. INCB emphasizes the need to improve consumption data for internationally controlled psychotropic substances and calls on government to collect and provide this data, which is essential for a better understanding of the levels of availability of key psychotropic substances. In view of recent developments in the medical use of ketamine and reports of increase in non-medical use and seizures, INCB requested updated information for governments on the national control status for that substance. INCB encourages important governments to issue a letter of no objection or other proof of the legitimacy of the import in cases where ketamine is imported from countries where it is controlled. More than 30% of respondents to the INCB survey reported ketamine seizures or trafficking involving their territories. Given the resurgence of trafficking of non-medical use and non-medical use of ketamine, it has also been one of the target substances in the INCB time-bound intelligence operations, Operation Trends in 2020 and Operation Knockouts in 2023. In these operations, a total of 274 ketamine incidents were reported with over 517 kilos seized in the most recent operation. Furthermore, a total of 5 tons of seized ketamine have been communicated by governments through the INCB Ionics system. While diversion from legitimate channels continues to be a significant source of supply for illicit use, increasingly sophisticated illicit laboratories have enabled operators to synthesize ketamine from various internationally non-controlled chemicals. The annual report highlights challenges and opportunities in promoting drug treatment and rehabilitation according to the UNODC and WHO international standards for the treatment of drug use disorders after the COVID-19 pandemic. The pandemic brought to the fore challenges in treatment and rehabilitations, and at the same time catalyzed innovation in treatment services, such as through telehealth and technology. INCB urges states to ensure access to voluntary, evidence-based treatment services, address systemic disparities, and ensure inclusivity with special attention given to vulnerable groups, and continue to focus on initiatives to combat stigma and discrimination. Governments are called upon to close compulsory treatment facilities and shift efforts and resources towards provision of evidence-based treatment services and alternatives to imprisonment. Collaboration between governments and the international community is encouraged to strengthen management and monitoring capacities, data collection, and data sharing, which serve to inform and improve public policies and the provision of treatment and rehabilitation services. INCB urges states to implement continuous review mechanisms directed at licensed treatment facilities and their territories to ensure compliance with the standards. There is growing evidence showing significant linkages between drug-related crimes and the environment, but further research is needed. Illicit drug crop cultivation, predominantly in remote and ecologically fragile areas, results in significant impacts on legal ecosystems and biodiversity. The carbon footprint of illicit drug production has implications for climate change. Cocaine production emits an estimated 8.9 million tons of carbon dioxide per year. Aerial spraying of illicit drugs crops can harm non-target species and result in soil and water contamination. Attaining the balance between addressing drug-related crime and minimizing environmental harm remains a complex challenge. INCB calls on government, with the international community's support, to take urgent action to address such threats, prioritizing the safety and well-being of local, indigenous, and vulnerable populations, as well as the protection of the environment. INCB also urges government to collaborate with the international community and with the United Nations systems in improving the available research and data on the impacts of illicit drugs and the environments across all regions. Moving on to specific regional findings, the board has noted the following. Governments in Africa are making progress in addressing substance use disorders. However, assessing the extent of drug misuse and accurately estimating the number of people receiving treatment remains a challenge. The Central America and Caribbean region suffers from a high level of armed violence and insecurity, often linked to the activities of drug cartels and street gangs. The opioid crisis continues to have serious consequences in North America. An increasing number of opioid-related deaths involved illicitly manufactured fentanyl, often mixed with other synthetic drugs. In South America, record levels of illicit coca bush cultivation were recorded in Colombia and Peru. Drug trafficking organizations continue to expand their operations in the Amazon basin into illegal mining, illegal logging, and wildlife trafficking. Illicit opium poppy cultivation and methamphetamine manufacture are among the most significant drug challenges facing East and Southeast Asia. Investigations in South Asia have found that proceeds of drug trafficking are being used to fund terrorism, provide support to armed groups and fuel political violence in South Asia. Instances of joint trafficking of drug and weapons have also been reported. Countries in West Asia face challenges associated with the illicit manufacture of, trafficking in, and misuse of synthetic drugs, including new psychoactive substances and pharmaceutical drugs. The 2023 opium harvest in Afghanistan declined significantly. The quantity and variety of substances available in illicit drug markets in Europe pose a considerable public health concern. Pacific Island states have transformed from solely transit sites along drug trafficking routes to destination markets for synthetic drugs, posing significant challenges to communities and their public health systems. Many of INCB's recommendations to governments and international and regional organizations have already been covered in my presentation. However, I would like to briefly emphasize 3 points. INCB reiterates the importance of universal adherence to the drug control conventions and urges states that have not yet become party to one or more of the treaties to take steps to do so without delay. In view of the substantial proportion of overdose deaths resulting from illicit fentanyl manufacture and newly emerging highly potent synthetic non-fentanyl opioids encountered in drug markets globally, INCB encourages government to participate in INCB grids program training and utilize INCB tools. INCB reiterates its concern regarding the legalization of the use of cannabis for non-medical purposes and recalls the thematic chapter of its 2022 report and reminds all parties to the 1961 Convention as amended that under Article 4, Paragraph C, and under the provisions of the Convention, the production, manufacture, export, import, distribution of, trade in, use and possession of drugs are limited exclusively to medical and scientific purposes. The apparent tension between these provisions and the trend towards legalization must be addressed by the signatories to the Drug Control Conventions. I'm shifting to the Precursors Report 2023. The world precursor situation in 2023 was characterized by a fast-changing pace of illicit drug manufacture, with pre-precursors or custom-made precursors increasingly being used to circumvent controls. The illicit drug industry is also exploiting loopholes in illicit markets to recover precursors from non-controlled products that fall outside the scope of control of the 1988 Convention. At the end of 2023, INCB recommended to place under international control 2 series of amphetamine-type stimulants precursors to address the proliferation of closely related designer precursors with no known legitimate use. The proposal puts into practice Commission Resolution 65/3, which, amongst other things, invited INCB and member states to consider derivatives and related chemicals which may readily be converted to or used in place of a controlled precursor. INCB also recommended that 2 fentanyl precursors be placed under international control based on a proposal by the government of the United States and final and INCB assessment. The final decisions on these substances will be voted on at the upcoming session of the Commission on Narcotic Drugs in March, in this month, of course. Non-scheduled substances continue to spread geographically. There are now 70 countries and territories in all 5 continents that report seizures of precursors not under international control. Most designer precursors that have emerged recently have been included in INCB's International Special Surveillance List of non-scheduled chemicals. The Precursors Report analyzes data on seizures of precursors reported by governments and communicated through the Precursors Incident Communication System, PICS. There were notable seizures of cocaine precursors and dismantling of cocaine extraction laboratories in Europe, reflecting a trend towards greater sophistication and process optimization. There was a surge in seizures of non-scheduled fentanyl precursors in North America. In terms of precursors of amphetamine-type stimulants, 21 countries reported seizures of preparations containing pseudoephedrine, the largest number of countries in 10 years. Finally, there is a continued decline in the reported seizures of the key heroin precursor, acetic anhydride, since 2018. In response to the exploitation of internet platforms by drug traffickers to source precursors chemicals for illicit drug manufacture, INCB provided training to officials from 4 continents on the investigation of suspicious postings on the internet regarding precursors. INCB encourages government to map their national industries that deal with the chemicals used for illicit drug manufacture and which might often unknowingly be targeted by traffickers with the aim of raising awareness among relevant industries. INCB's online platforms for facilitating the monitoring of international trade and controlled precursors, Pen Online, as well as non-scheduled chemicals, Pen Online Lite, continue to prove their effectiveness. Use of Pen Online Lite has helped to stop shipments of more than 350 tons of gamma-butyrolactone, GBL, in 2023. As in the past, investigations have also benefited from real-time information sharing through INCB's Precursors Incident Communication Systems, known as PICS. Free trade zones promote trade and industry through simplified and reduced taxation, but are also vulnerable to drug and precursor trafficking. Operation Insight, conducted jointly by INCB with WCO and the UNODC WCO Container Control Program, helped to advance knowledge regarding free trade zones and raise awareness among governments about the need for proper oversight over them in accordance with the requirement of Article 18 of the 1988 Convention. The operation provided evidence of the vulnerability of free trade zones to be exploited for precursor trafficking. Notably, a seizure of a significant amount of pharmaceutical preparations containing pseudoephedrine was reported, which was linked to one such zone. Finally, this year's Precursor report thematic chapter provides an account of the implications of conflict and unresolved territorial disputes for precursor control. INCB recommends that countries make use of Pen Online and Pen Online Lite and other INCB tools for non-scheduled and scheduled precursors, and that they expand the use of PICs for sharing more incidents related to precursors and equipment on a real-time basis and including actionable information. To protect licit industries from traffickers, INCB recommends that governments enhance knowledge of their national industry landscapes by determining which categories of industries that might be involved in the manufacture, trade, or distribution of chemicals used for illicit drug manufacture are present in their territory. INCB also encourages governments to ensure that the regulations and procedures put in place for free trade zones are no less stringent than those applied in other parts of their territories in order to prevent drug and precursor trafficking. Governments are also encouraged to make use of the WCO guidance regarding customs procedures for such zones. INCB encourages government to make monitoring investigations of the Internet an inherent part of their activities related to the regulation and enforcement of precursor control mechanisms. INCB is supporting member states in their implementation of the drug control conventions and in their pursuit of the Sustainable Development Goals, a key tool in the INCB Learning Program. In 2023, 2 regional training seminars and 3 availability workshops were held for 120 officials from 20 countries. Over 1,462 officials from 154 countries have enrolled in the e-learning modules available in English, French, Russian, Spanish, and Portuguese. With the expanding GRIDS program, Focal Points Network, there has been a continued increase in the number of real-time incidents involving non-medical synthetic opioids and new psychoactive substances communicated through the INCB Ionics platform, exceeding 77,000 in 2023. Consequently, governments have been able to carry out investigations and analyses that have in turn led to seizures of dangerous substances, arrests of traffickers, prosecutions, and disruptions of international trafficking networks. Operation Knockout, coordinated by INCB, involved 160 law and regulatory officials from 76 national agencies and organizations and 6 international partners. It led to 671 seizures amounting to more than 1 ton of drugs. During the reporting period, 5 global alerts and special notice were circulated to Project ION and opioids focal points for voluntary action by law, regulatory and private sector counterparts. Over the past year, the INCB GRIDS program convened 26 training events for more than 533 law and regulatory enforcement officers and postal inspection officers representing 58 governments and 2 international organizations. I will leave you with 3 key takeaways from these 2023 reports. The first one is there are opportunities to use the internet and social media for drug use prevention and treatment. And there are challenges for drug control because drug traffickers are using the internet and social media, including encryption and cryptocurrencies, to evade detection. INCB is helping governments to address these problems through its Precursors, Control, and GRID programs. Secondly, data reported to INCB continue to confirm the persistent inequities in availability of internationally controlled substances for medical purposes. Levels of consumption of affordable morphine in regions that other than Europe and North America, are insufficient to adequately address medical needs. The INCB Learner Program is supporting governments to improve this situation by improving the accuracy of estimates of medical requirements. Thirdly, trafficking in cocaine, synthetic drugs, including non-medical synthetic opioids and their precursors, represents a growing global public health threat. New INCB initiatives are supporting governments in capacity building, strengthening partnerships with industry, mapping industry sectors, and preventing diversion and misuse of specialized equipment used in illicit drug manufacture. Collection of data on drug use and treatment demand needs to be improved so as to inform the development of evidence-based prevention treatment programs. This brings my presentation to a close. I'd like to also thank all the board members and all the secretariat staff for the wonderful work they put to get this report together and to be presented before you today. I look forward to taking your questions. Thank you so much.
Thank you very much indeed, Mr. President. For those of you who are following on UN Web TV, you can submit questions to press.vienna@un.org. But for those of you in the room, please let us know if you'd like to ask a question, and my colleague Emma will come with a microphone. For the journalists in the room, the floor is yours. Don't be shy. Please.
Hello, my name is Albert Otti with DPA, German Press Agency. I have a German-specific question. There is a little section on Germany in your report on the legalization of cannabis. The German government argues that its legalization process will have to fight the illicit market with its very high toxically high levels of drug chemicals, and that it will also make it harder for people to access other drugs because in the future they will not need to go to illicit dealers. What do you think about the legalization process in Germany and about these arguments?
Well, I can discuss my own arguments and my own comments about the potential benefits of any legalization. That's not within the scope of my duty, but I can discuss that I can tell you that this was the case for many countries, as you can imagine, and all the countries that have already legalized cannabis for non-medical use. It's still in contravention with the treaties and conventions, and that will remain until it's decided otherwise by the international community through the CND. And I think it's really for the member states to deliberate on this, and it's for the member states to make decisions once and for all. It's not for the INCB. The INCB sees it again that legalization of any substance that's under international control for non-medical or non-scientific purpose is still in contradiction and contravention with the international with the conventions. That's my take on this. Other benefits, be it on the public health, be it on the on drying up the markets, being on the trafficking. That's something that I leave it to the German governments. But from the INCB, that's the firm statement and a clear one from the time being. Now, if you want to take it to the member states, I think that's the best platform for discussion.
Okay. Thank you very much indeed. Please, from Effie.
In the report, there is a section about Haiti. The situation there is getting worse with gangs trying to get control of the international airport, of ports, etc. Do you fear that Haiti can become a narco state and be the platform to send drugs to the US and Europe, etc. Thank you.
Well, I think the INCB cannot anticipate on the evolution of any or development of any situation in any given country. That's not within our mandate. What I can tell you is that for every area in the world that's going through emergency crisis, that's going through any emergency crisis that needs any involvement on our part, we will take that seriously. But then how things will evolve in Haiti in the upcoming weeks, whether it will become a narco state, that's something I can't comment on because I don't read the future. I'm sorry about that.
Okay, further questions, please. Please, yeah.
Thank you. When you mentioned that you speak about internet platforms and social media, etc., but there is not a single name in the whole report, and not a single concrete example of anything. So it's could you elaborate a little bit about that, because it's really not too much what we can get from the report about the use of criminals of social media and so on. Thank you.
Well, I don't have, concrete examples, but I think that it's been mentioned in many studies that actually drug traffickers are using social media to promote. To use also the legitimate platforms to promote for drugs and to promote for drugs with sometimes false facts, and to also advertise for drugs. Maybe in indirect ways, but that's something that's in the social media. There are many examples of them. But I don't have concrete examples to give you with names, but I think that's something that's there. Promoting drugs and promoting and reaching and targeting the youth, targeting children, and targeting the young population is, I think, something that's been there for years now.
Okay. Other questions? Please, Albert, from DPA.
I have a general question on your focus section on internet and drugs. I don't really understand what benefit does it have for policymakers or the public if you tell them that drugs are being sold on the internet? Because that's basically what you're doing. I don't see any in-depth analysis of how big the problem really is. You're citing papers, but then you say, but they're not your own analysis, and basically you're saying it's a growing problem, but you don't say how big is it growing, and you cite online pharmacies, but you don't say exactly what drugs they're selling or what role they're playing. So why did you include this?
Well, chapter 1 has always been a thematic chapter that does not necessarily goes into depth in analyzing a problem, but the purpose of the chapter 1 is really to bring the attention of the international community to a given topic, and I think the 13 board members have chosen that topic last year because of the evolving phenomena of the use of internet and social media by trafficking. But also, don't forget the other part of the coin, the other side of the coin, which is also the opportunities that we see for government to use the same internet and social media for actually promoting access to information and also prevention and treatment and telemedicine. So it's not only about the trafficking, it's also about the opportunities that social media and internet can offer. But also the third part of it is how the INCB is using internet through its programs to actually promote exchange of information, real-time information, also to control import-export, to control also for trafficking and using, also to connect the public and the private and the industry. So that this is a positive use of internet and social media. So it's really the all aspects of the use of internet and social media, be it for trafficking, but also for the benefit of health and promotion of access to information, prevention, and treatment. So it's never, chapter 1 is never about, it's never really going into depth. Chapter 1 is really raising awareness about a specific topic. That's how chapter 1 was always.
Okay. Any final questions? Doesn't look like it. So thank you very much. And I don't see any questions in the chat here. So thank you very much for attending. I know that at least one of you, probably more, would like to speak to the President separately. And you can certainly do so here. But thank you very much for attending in person and online. Thank you very much. Thank you.
Thank you. Thank you to all of you. Thank you very much.